Are you or a loved one expecting a baby? Have you thought about getting a labor epidural but were confused about all the information that's out there on the internet? Well, stay tuned, this video is for you. Hi friends, welcome back to my channel. I just finished a 24-hour call shift at the hospital. Part of my role as being an anesthesiologist is placing labor epidurals. Many times I find that a lot of my patients are misinformed about what exactly an epidural is. So I thought this would be a good opportunity for me to go through some information about labor epidurals. In this video, I'm going to discuss what exactly is a labor epidural, how it's administered to you, what are the risks and benefits of the labor epidural, and then I'll also finish off by discussing some of the alternative forms of pain relief that's available if you choose not to go with a labor epidural. This video will allow you to make a more informed decision about whether this form of pain relief is appropriate for your specific situation. The word epidural actually refers to a potential space around the spinal cord and spinal nerves. The epidural space contains several important structures including spinal nerves, blood vessels, and fat. When we talk about an epidural for pain relief, we're actually talking about what's called epidural analgesia. Epidural analgesia is one of the most effective ways to provide pain relief for the pain of childbirth. You should feel free to request a labor epidural whenever you feel it's the right time. From my experience with my patients, generally this is around the time when you're 4 to 5 centimeters dilated. Pain is a very subjective experience and it's variable for different people. You may experience more pain if you're receiving specific medication to augment your labor, which makes your contractions much stronger. Once you've decided that the labor epidural is a type of pain relief you'd like to go with for your labor, you will inform your nurse. Your nurse will subsequently inform your anesthesiologist and start getting things ready. While you wait for the anesthesiologist to arrive, your nurse may give you some brief information about the epidural. Your IV will be tested out to make sure it's functioning well, and a bolus of fluid will be administered to you. Next, the nurse will start positioning you into the appropriate position. The two most common positions for you to be in while receiving your epidural is either in the sitting position or lying on your side. The position really depends on the anesthesiologist who's working that day. We usually describe the best posture to be in is with your back arched outwards, similar to what an angry cat looks like. The anesthesiologist will start by setting up his or her tray in a sterile manner. They'll put on some sterile gloves and they'll start cleaning your back off with some antiseptic solution. Once this is done, they'll begin to freeze your skin with some local anesthetic. This is usually the most uncomfortable part and feels like a small bee sting, and the burning usually lasts about 5 seconds. It's very similar to the way the dentist freezes your gum at the dentist. Once your skin is thoroughly frozen, another specialized needle called a TUI will be introduced in the lower part of your mid-back. It should be noted that this needle is not placed into your spinal cord, but the tip is introduced very carefully into the epidural space that we talked about earlier. Once the needle tip is in place, a very thin plastic catheter called an epidural catheter is introduced into the epidural space through the hollow part of the needle. Once the anesthesiologist is happy with the placement of this epidural catheter, the TUI needle is carefully removed, leaving the epidural catheter in place. This epidural catheter is taped on your back and usually hung over your shoulder for access later on. It's very important to note that once the procedure is complete, the only thing that remains in your back is a very thin plastic catheter. Nothing sharp remains in your back. At this time, you should be free to lay back in bed and you should not have any pain or discomfort in that area. Once you're laying back in bed, the anesthesiologist will start introducing some medication into the epidural catheter that was just placed. This medication is a local anesthetic similar to the one that was used to freeze your skin. This medication usually takes about 10 to 15 minutes to slowly work and give you some pain relief. While the anesthesiologist is giving you this medication, the nurse at this time will be placing some monitors on your abdomen as well as a blood pressure cuff so that they can start taking regular measurements of your baby's heart rate as well as your blood pressure. Again, it's important to note that once the anesthesiologist starts giving you this medication, pain relief is not instantaneous and usually takes about 10 to 15 minutes. Once the anesthesiologist is happy with the level of pain relief that you've achieved, they will connect your epidural catheter to an infusion pump so that you will continuously receive some medication throughout your labor and you'll remain comfortable. The quantity of medication that you'll receive through your epidural catheter is prescribed by your anesthesiologist and is specific to your labor and your situation. The duration of the entire procedure usually takes about 15 to 20 minutes, and it's largely dependent on how easily the anesthesiologist is able to identify the epidural space in your back. Once you're comfortable, your nurse will encourage you to lay back in bed, get some rest while your labor proceeds. Epidural analgesia is one of the most effective ways to give you pain relief during childbirth. It usually has very minimal side effects on you and your baby. Most women who have a labor epidural generally don't feel any pain during childbirth. Relief from the pains of labor can help you get more rest. This is especially beneficial when your labor is prolonged. Additionally, being pain-free allows you to have a more positive birth experience. An epidural can help you stay alert so you can take an active part in the birth experience. It can also spare you discomfort if forceps or vacuum are needed to help get your baby out. An epidural can provide continuous pain relief during long surgical procedures such as C-sections, or if you need any sort of surgical intervention such as repair of vaginal tears. If you do need a C-section, the epidural catheter will be used to give you much stronger medication so that the lower part of your body will be totally frozen during the procedure. At this time, you'll be able to have the surgery and remain awake and experience the birth of your baby. The feeling in your lower part of your body will usually return within about 2 to 3 hours. I usually tell my patients about several common and rare complications with epidural analgesia. The common complications include a failed block, getting a drop in blood pressure after the medications are introduced, and sometimes getting a headache after the procedure. A failed block occurs for many reasons. Like any procedure, the epidural catheter may not have been placed in the precise position that it needed to be in. Your anesthesiologist will begin by troubleshooting this situation by giving you some more medication to see if they can achieve a better block. The second thing they may do is pull the catheter back about 1 centimeter to make sure that the catheter is not placed in the wrong spot. If these two things don't work, the anesthesiologist may elect to redo the entire procedure so that the epidural catheter is placed into the epidural space. Low blood pressure usually occurs after a bolus of medication has been introduced through your epidural catheter. This happens because once the medication enters the epidural space, one of the side effects is it relaxes the blood vessels in the lower part of your body, and this causes a drop in blood pressure. You may notice this with a feeling of dizziness, feeling lightheaded, or some people even feel nauseated. Again, this is a very common side effect or complication from introduction of a labor epidural, and it can be easily fixed with giving you some IV fluids through your intravenous, as well as giving some special medication to bring your blood pressure back up. This complication usually lasts only about 5 minutes and is not a serious one. The headache associated with epidural analgesia is called a post-dural puncture headache. The post-dural puncture headache happens when the epidural needle is placed a little bit too far past the epidural space. About 1 to 2% of patients who get an epidural will experience this type of complication. Among this 1 to 2%, about 50% of patients will develop a subsequent headache. This headache is not life-threatening and can easily be treated. This headache is a specific type of headache in that it comes on when you sit up, and then when you lie flat, it goes away. Some of the rare complications from labor epidurals include bleeding, infection, local anesthetic toxicity, as well as nerve injury. Bleeding around the epidural space is a very rare complication of epidural analgesia. This usually occurs if there's trauma around the blood vessels or trauma during the insertion of the epidural. It can also occur if you're on any special blood thinning medications or if you have any undiagnosed clotting disorders. Your anesthesiologist will make sure to review your chart before placing the epidural and will only offer the epidural to you if you are at low risk of this type of complication. Infection is another rare complication of introducing a labor epidural. Infection occurs anytime the natural defense mechanisms of your body are breached. So when we place the needle into your back, there's always a chance that we could introduce an infection into the epidural space. This is minimized by ensuring that your back is cleaned with antiseptic solution. The anesthesiologist wears sterile gloves. The tray that the anesthesiologist uses is kept sterile. Although extremely rare, an infection into your spinal canal is also caused by an infection somewhere else in your body. Your anesthesiologist will review your chart and only offer the epidural if they are sure that you don't have an infection anywhere else in your body. Local anesthetic toxicity happens when local anesthetic, rather than being introduced into the epidural space, is accidentally injected into one of your blood vessels. Now, this can happen if the epidural catheter is inserted into the epidural space and it migrates into one of the blood vessels that are located inside the epidural space. This is a very rare complication, and early signs of it can usually be detected by you having changes in your blood pressure reading as well as changes in the taste sensation in your mouth. If this happens, your nurse or anesthesiologist will stop all the medications that are being introduced into your epidural catheter, and then appropriate treatment will be given to you. Nerve injury usually occurs when your anesthesiologist introduces the TUI needle into your epidural space. This needle may temporarily rub up against a nerve and cause some transient numbness that may occur at the time of insertion. This usually happens in about 5 to 25% of cases and usually resolves as soon as the needle is removed. Persistent numbness that lasts several weeks is extremely rare, and permanent numbness that does not go away is extremely rare and almost unheard of. While on the topic of nerve injury, I also want to mention something about back pain that many people usually complain about after childbirth. Now, back pain usually is related to childbirth and is not specifically a side effect of having an epidural catheter placed. Usually after an epidural catheter is placed, you may experience a little bit of numbness around the needle site, similar to when you get a vaccine on your arm. Persistent back pain is usually not a consequence of having a labor epidural placed, and usually studies have shown that whether a woman has natural childbirth without an epidural or an epidural, the incidence of back pain is similar among both groups. Now that we've talked about epidural analgesia, I'd like to go on to talk about some of the other forms of labor analgesia available to you. Opioids are strong pain medications that are given intravenously. These include medications such as morphine or fentanyl. Though generally they're not as effective as epidural analgesia, they do make some of the pain of childbirth a bit more bearable, and they don't cause any numbness across your abdomen. They're generally safe, but they do have some side effects for the mother, which include some nausea and vomiting, itchiness, as well as a little bit of drowsiness. In general, for the baby, opioids are safe, but cannot be given just before delivery because they may slow the baby's heart rate as well as respiratory rate. Nitrous oxide, commonly known as laughing gas, can also be used as a way to relieve pain during childbirth. Generally, nitrous oxide is given through a face mask that you would hold yourself and breathe just before you experience any contractions. They generally don't work as effectively as epidural analgesia or opioids, but they do take some of the edge off the contraction pain. Some of the side effects of nitrous oxide include dizziness, feeling a bit lightheaded, and some nausea. There are also many natural remedies that may help relieve pain of labor. These can be used on their own or in conjunction with other medications. So these type of natural remedies include hot and cold packs on your back, massage, taking warm or cold showers, as well as aromatherapy. Epidurals are generally considered safe, but the decision to have one is a very personal choice. Ultimately, it's up to you to decide the pros and cons and decide whether this form of pain relief is appropriate for your circumstances. Even if it's not part of your original birth plan, it's nice to know that a labor epidural can be had at any time during the labor process. The best place to get more information about the options available for your specific circumstance is from your own doctor. I hope you enjoyed this video. If you have any questions or comments about the content of this video, please leave a comment and make sure to subscribe.